Yeah. So I think that my twins, they were born a year after my daughter. I have identical twin boys. They were 6 months old, and my husband noticed I was spending a lot of time mentoring moms and talking to them about breastfeeding, particularly in a multiples setting. How do you breastfeed twins? I was only 6 months ahead, but I had overcome a lot. And he's like, is there a business in this?
Hmm.
And it just, he set something off in my brain. And I think for over the next couple of years, I already had a degree, but I went back to school. I was doing it in the middle of the night. And I would think I was 35 when this happened. And I had this just huge passion, desire, just energy that went towards that. So for the last since 2020, I've been focused on this field. I'm an international board certified lactation consultant. So that's referred to as an IBCLC. And I work with patients on their feeding journey, ideally prenatally. I would say that's the big area of my business that I wish we saw more success. I wish more people came to me when they're pregnant as they're wrestling with how they might want to feed their baby or babies. But my business is called Milk and Grace, but I do what we call out of office, so private practice. So I see people usually outside of the hospital, either in their home or in an office setting. My appointments are, much longer than the help you get in the hospital, more like an hour, sometimes up to 2 hours if it's really complex. There is an option, and I do virtual appointments pretty regularly. I think the big pain point is that most families prefer this to be something that's covered by insurance. And so a lot of the barriers I face to supporting families is, does their insurance cover a virtual appointment? And that can be kind of the deciding factor of them making that investment. But I am able to do virtual appointments. I would say in certain situations, a virtual appointment is absolutely beneficial. And in other cases, it is ideal to be in person because there are certain things that I can identify in an in-person consult that I have a harder time doing over Zoom. I would say just that a lot of women think that they are going to get support and accurate information in a hospital. Like when they give birth in a hospital, they think there are going to be providers there that know about breastfeeding that can support them in that, and are surprised to find out that hospitals are businesses, that they are strained in staffing, that their lactation consultant, if they give birth on a Sunday, might not even be there, that their pediatricians may have very minimal training in breastfeeding. So I think a big pain point is families getting inaccurate information and kind of relying on these outside people that they think are going to know what to tell them, but are, really just seeing them for a few minutes and not able to help them kind of come upon their own answers. Other than that, I would say that lactation consultants have kind of a reputation for being so obsessed with breastfeeding that we're not going to support formula use. We're going to shame a family if they want to combo feed. And to the contrary, I've had families that I work with that I gently encourage that weaning is the right option for them at a certain crossroads. So, I think having them realize that lactation consultants, we really are infant feeding specialists. We can help with formula selection. We can help with combo feeding plans. We can help with pumping. And we're not dogmatically obsessed with exclusive breastfeeding. So a lot of times the first appointment, there's a lot of history taking, and, you're seeing a baby one time in one environment. Maybe it's one of their best feeds they've ever had or one of the worst feeds they've ever had. But once I hit that second or third appointment, I'm seeing more of the patterns. I'm seeing more of the whole picture. It varies. I would say the families I work with, how complex their situation is. If I see them one time and they just kind of need the pat on the back, hey, everything is going great. I've measured what they transferred. I've, checked in with you. Everything's looking good. That's all they need to hear. Mm-hmm. And they might check in with me in the future at some other milestones, like introducing solids or if their baby bites or something like that. But otherwise, I would say, we're anywhere between 1 to 6 visits is typical. And I would say 3 is where a lot of times it lands. I think my biggest goal, like something that I just find so important and makes this work so meaningful to me, is that sometimes feeding journeys, just like everything in life, don't turn out the way we hoped. We might go into giving birth and have a baby and think this is how I want to do things. And then, there's just many variables that can change that. But I think when you have someone walk alongside you, when you get accurate information, when you get support, even if the end result isn't what you hoped for, when you look back, you don't have those questions of what if someone had helped me? What if someone had known those, answers?